Welcome back. You're watching India Tonight with Shibani and myself, Jude Sanat. On to our next big story of the day. The recent altitude drop incident on Air India's Phuket-Delhi flight has put the spotlight on aviation anti-dope testing norms and the need for stricter regulations. Now, reports state that the aviation watchdog DGCA is keen to strengthen the rules and stakeholder opinions will in fact be sought. In fact, Shibani, this is a discussion we've been having multiple times over, especially on the need to bring in more stringent norms. It seems like the DGCA could well be biting the bullet on that front, especially when it comes to dope testing in Indian aviation.
Absolutely, Jude. And the Federation of Indian Pilots has in fact urged aviation safety regulator DGCA to consider oral fluid testing as a complementary method alongside with the existing urine-based screening under the drug testing framework. With the recent escalation, will there be a change in regulation? First up, my colleague Sumita gets us more updates on the recent happenings.
That's right. Following recent incidents of pilots failing doping tests, India's civil aviation regulator is reportedly considering a new and more stringent civil aviation requirement governing testing for psychoactive substances amongst aviation personnel. In fact, reports also suggest that the proposed CAR is aimed at strengthening the existing framework governing the testing of aviation personnel for consumption of psychoactive substances. Now, this meeting is expected to be about new provisions that are related to the testing processes, and that includes changing in testing requirements, sample size. The Federation of Indian Pilots, remember, that has reportedly urged the Director General of Civil Aviation for a comprehensive overhaul of the country's psychoactive substance testing regulations. And remember, this is coming in after the incident on an Air India flight earlier this month happened. Of course, the pilot's body has asked for double mandatory random drug testing, introducing oral fluid testing screening along with exercising existing urine tests and enforcing strict procedural safeguards to protect crew members. So, of course, how that representation is now going to be taken up by the DGCA, that remains to be seen.
Well, thanks, Sumita, for bringing us that all-important update. Now, to make sense of what exactly the change in regulations mean and why it's being brought in now at this time and place, and what exactly the changes, we're joined by a very special guest. Captain Minu Wadia is the founder-president of the Federation of Indian Pilots. Captain Wadia, thank you so much for joining us on India Tonight on the Bulletin today. My first question to you, help us make sense of this. Now, what the Federation of Indian Pilots has done is urged the DGCA to consider the oral fluid testing as a complementary method to existing screening mechanisms that are followed. But I sometimes wonder, sir, did it actually take an incident much like this one to actually press for the need for a more comprehensive complementary testing method? Should this not have been the standard to perhaps be followed in the first place so as to prevent the possibility of events much like this, Captain Wadia?
Yes, first of all, let me clarify that any substance, whether it's liquor, drugs, or any substance that will impair this normal, clear thinking of a pilot in the aircraft is certainly not acceptable at all. In this particular case, just because the media has covered it so strongly about this aircraft dropping and the pilot having had drugs, I think there seems to be a knee-jerk reaction. First of all, I am not sure whether there are enough testing laboratories available in Bombay, Delhi, etc., for carrying out more drug tests on anyone, whether it's pilots, ATC, or engineers, or whoever. But if you have the facilities and you do test it, and if there's any substance which can hamper your normal thinking, is certainly not acceptable, and the stringent action needs to be taken and must be taken. There's no two ways about it. However, a little more thought needs to be into the testing methods, what is the procedure, and the pilots need to be informed in the airlines as to even say a polluted food item may induce or give you a positive result of a drug. So a little more studies and a little more awareness and information should be available to the aviation authorities.
Thank you so much for joining us, Captain Meenu Wadia. Now, Air India, in particular, has faced several, severe scrutiny over pilot fatigue and the kind of grueling rosters that they have, and not just Air India, many airlines around the world. So help us understand, and I wanted to gauge your perspective since you are a, you lead a pilot body. Help us understand to what extent is, this entire systemic fatigue causing the pilots to, resort to some of these psychoactive substances to probably, rest or sleep?
First of all, I don't think any opinion is required on this subject at all, because what you ask for is flight and duty time limitations, etc. There's no compromise on safety at all. Now, these duty time limitations are not at the whims and fancy of the airlines or DGCA. These have been found to be in effect in the world all over, depending on research done on the human body as to how much rest is required after how much time. It used to be stringently followed earlier. Now I know because of material considerations or the financial consideration of the airline, very often the director of operations or director of the airlines tell the pilot, we've got DGCA dispensation. First of all, on a matter of safety, I don't think any dispensation can be given or should be given at all. Even earlier, the Minister of Civil Aviation had said something about dispensation being given for safety compromise, which is certainly not acceptable. So any item, whether you're sleep deprivation or flight and duty time limitations or drugs or liquor or whatever, safety cannot be compromised under any circumstances. There's no two ways about it.
Absolutely, there's no compromise for safety on any flight or any other critical operation for that matter. Thank you for breaking that down, Captain Wadia. We're also being joined by Surjit Panesar, aviation expert, on the phone line. Mr. Panesar, thank you so much for joining the broadcast. What do you make of the Federation of Indian Pilots' appeal to DGCA to consider oral fluid testing? Better late than never, you reckon, Mr. Panesar?
Yeah, I agree with you, but listen to me, this Federation of Indian Pilots, I don't know how experts they have it, but in my opinion, which is a very strong opinion, that whenever you carry out the test, dope test, drug test, we must have a team of doctors and have a scientific study. Sometimes if you take a cough syrup and you go to the airport, alcohol blood analysis shows a little bit of alcohol in the blood, because we have taken we have to find out what medicines, if a pilot has taken, will that also affect the dope test and all that? It needs a very big scientific study, what drugs will improve, and limitation of drug tests also to be known very well. Although I agree with you that having drugs and all that is not acceptable anywhere in the country, especially marijuana and all that. But before you carry out the test, let there be a scientific study by the doctor that suppose a person is taking some regular medicine for blood pressure or some other reasons and the medicinal point, will those drugs also come out in showing the dope test also? It requires a deep study before we jump onto the decision immediately, the pilot, to ground the pilots and all that. I personally feel that the machine should be tested, sanitized properly, and the test should be done as per the dope test analysis, and the limitation should also be shown to the pilot. I have seen some pilots who have never taken alcohol in their life, but sometimes the breath analysis test shows positive alcohol. So there has to be some study by the doctor, scientific study to find out what are the drugs if you take, and then the airlines must issue the medicinal circular that the following drugs you watch out before you go for the dope test and all that. This is my opinion.
And before you joined in, Mr. Surjit Panesar, in fact, joining us here, Captain Meenu Wadia had, in fact, raised a very critical question, Mr. Panesar. He said that are there enough certified labs to test thousands of pilots quickly, and that too on a daily, on an hourly basis? And then where is the loophole over here? Also, given the saliva test, is it easier to cheat as compared to urine test? How do we find out?
Ma'am, let me tell you one thing. These tests should be done in the government hospitals, not in the private hospitals. All these tests should be done in a government hospital where the doctors are responsible for giving the results and the tests and the final results and all that. I find the private hospitals are not very competent to give you the positive testing. There's a proper procedure for the testing. In one of the cases, like a flight from Phuket to Delhi, those medical tests in the Medanta hospital are not done as per the dope test checklist. Why they have not done like that? The question is, it should be done in a government hospital where they are held responsible for each and every step of the test. They have done it. And there should be definitely a study on these things. What drugs can also give you the effect of the dope test also?
Right.
You see, it does not
You
jump
know,
on the...
Captain Waria,
Sir.
absolutely. No, so thank you. You made a very important point, Mr. Panesar, and that is the fact that if you do these tests, they need to be done in perhaps the most credible manner possible. And if that be done in a government institution or a government medical center or a hospital, so be it. So, Captain Waria, I have to ask you, does it all boil down to, in many ways, a case of easier said than done? Surely these suggestions and submissions to the DGCA come with the utmost, the best of intent. Safety is no doubt front and center of the very reason that these submissions and proposals even came to be. But implementing it, like we have been speaking of, and ensuring that the credibility associated with it at such a large scale, given the fact that these tests probably have to be run hours, every other hour, if not every day. Surely there's a lot of infrastructure that must be mobilized to have it done in the most foolproof manner possible, Captain Waria.
That's a very important point. And I'd like to doubly endorse exactly what Captain Panesar had told you earlier, that even I have seen that people who are totally teetotalers, had never had liquor in their lives, have tested positive before going on a flight. For the simple reason that earlier all pilots were aware that even cough syrup can give you a positive result. Same thing with the drugs also. The little more, and as I mentioned earlier, this seems to be a little knee-jerk reaction. By all means, if your total system is 100% in place and you're 100% sure that the person has consumed drugs, no sympathy needs to be shown at all. But before doing that, let's find out ways and means as to which are the drugs which can show positive results, which might be even food contamination, could be some medication that the pilots have been taking. So awareness and study needs to be done properly, and a foolproof, safe method evolve before you implement the law.
To Mr. Surjit Panesar for his final word. And as an aviation expert, help us understand what is the kind of impact that it will have on the aviation sector in India, considering it's a duopoly market already? The airlines, especially, in the coming months, when there is fog, face delays, there are passengers who are trapped inside airports for hours. If this is mandated, will Aam Janta, consumers, travelers like us, if the drug tests are mandated before the flight, will there be delays? What will be the impact of this going forward?
You see, I personally, I agree with you. First of all, let me tell you, there's no escape from the flight safety and all that. No, we must have a study by the doctor which drugs can affect you. It is not only dope test we carry, it just became positive. Why it has become positive? They should study the pilot's medical history also. Has he been taking some medicine? There are certain medicines for the blood pressure, sugar. There's so many medicines are available. Pilots are taking it. Sometimes the fatigue also, they take some medicine. They don't get sleep. They take sleep tablets also. Now, whether these tablets and all these will affect the dope test or not, there's a proper procedure mentioned in you can see in the Google map. What are the Google procedures for checking on the dope? Was it carried out properly? And I can assure you, once again, I'm telling you, it should be done in a government hospital, not private, which can be influenced also. There are people who can write anonymous complaint against Mr. A, B, and they carry out a test and they pass him or fail him. So the government hospitals are not influenced by all these things. I personally feel the test should be done in government hospitals because they are responsible for anything wrong. They can be punished also. And there should be deep study on the drugs and all which can affect the dope test. by all the doctors, and then the airline should issue the medicine bulletin to all the pilots. The following drugs may affect your dope test or alcohol test and all that, and you should avoid these things and all before the flight, because there's no margin for safety and all that. They should be tested positively.
Well, the fact is that, Captain Panesar and Captain Wadia, while the intention and the intent behind that proposal to, solidify the dope testing and, random testing on pilots comes from a place of safety being put first, there's a long road ahead before it is implementable in perhaps the most credible way possible. But gentlemen, thank you so much for joining Shibani and myself on the Bulletin tonight to break down the intricacies behind more comprehensive testing. Great speaking with you on the show.